Hello, everyone, and welcome to our question lab. We're happy to have you here, and this evening we will be covering respiratory physiology. So we're happy you're here. Today, our discussion is going to be led by Dr. Paras Vicaria. Paras, I'll let you introduce yourself.
Thank you, Sean. Hey guys, my name is Paras. I am a dermatology resident at UT Southwestern in Dallas, Texas. I am originally from Michigan. I went to pharmacy school in St. Louis, Missouri, and then graduated and went to medical school back home in Michigan. I've worked with Rx, USMLE-Rx as an Rx coach for about a year now, working primarily with students one-on-one when it comes to the USMLE Step 1 exam.
Awesome, and we're really happy to have you here. And in addition, if you guys look at your question panel, or your control panel here for GoToWebinar, you'll see a question box. And in that question box, you're able to submit your questions. And we have some panelists on standby that will try to do their best to answer those questions for you. We have Kate with us, and we also have Mark Heslin. Mark, do you want to introduce yourself?
Hey everyone, my name is Mark Heslin. I'm a fourth-year medical student at Cooper Med School in Camden, New Jersey. I've been working with Rx now for about 7-8 months, working mainly with students for Step 1 and also Step 2 CK. I'm happy to answer any of your guys' questions.
Excellent. Thank you for being here, Mark, and thank you for being here, Kate. As always, we also have Jeff, who you'll hear from later when we do the raffle. Friendly reminder that we do a raffle at the end of every webinar, where a lucky winner will get access to our resources free of charge, but you must be present to win. So hopefully you guys will all stick around, and a lucky winner will walk away with a very valuable prize. My name is Sean. I've been the RX coach for going on almost 2 years now. RX Coach is our new tutoring program, and we'll talk about that here a little bit later this evening. You've had a chance to meet us. We'd love to get to meet you. So I'm going to open up a poll and ask you guys a question, and that question is pretty simple. Who are you? Please let us know. We always like to know who's in attendance. So we'll give you guys a few seconds to respond, and for those of you who are here for the first time, feel free to let us know in the question box if you're a newcomer. We'd love to know. And this is the same format that you'll see for all 4 questions that we'll do today on respiratory physiology. And you'll be able to input your responses just like you are right now. I see the responses are coming in a little slowly. We'll give you guys a few more seconds, and then we'll get started. All right. Excellent. And let's see who is in the audience this evening. So it looks like, once again, we've got a lot of international medical students and graduates, and a lot of US and Canadian-born international medical students and graduates, along with some US and Canadian MD and DO students. So welcome to everybody, and thank you for being here. We know that most of you guys are studying for Step 1, so we'd like to know, when are you guys planning on taking the exam? Are you guys going to take it later this year, early next year, middle of next year, end of next year, or even the following year in 2022? I see some of our coaching students here saying hello in the question box. Hello to you too, and welcome to our question lab. Next week, we'll be covering bacteriology. So next week, Tuesday at 6 p.m., the topic is bacteriology. So we hope you can join us then as well. All right, and let's see when you guys are taking your exams. Looks like a lot of you guys are taking it this year and early next year. So we're happy that all of you guys are here, and hopefully you guys will find these sessions in tonight's session helpful and beneficial. So thank you for attending. Like I mentioned earlier, Paras and Mark are some of our wonderful RX coaches, and RX Coach is our new individual one-on-one coaching and tutoring program. We've had a lot of great success with it. We'll talk more about that later, but the methodology we're going to use today and that Paras will describe to you is the same methodology that we use in RX Coach. So with that being said, let's go ahead and jump into our first question this evening on respiratory physiology. Now, you guys will see here that the answer choices are covered up. That is by design. The first step of our method is to cover up those answer choices. And the reason we do that is because we don't want these answer choices to guide or dictate your thought process, and we certainly don't want you guys to see an answer choice that you're unfamiliar with, and that may cause you to panic as you're trying to answer that question. So I've gone ahead and removed those answer choices for you. And then we will start by reading the lead-in, which is the last sentence or the question itself. Which of the following is the most likely diagnosis? For those of you that were here last week, we're going to do something different here. I'd like for you guys to let me know in the question box what you think the two most important words are in that lead-in. What do you think are the two most important words and clues in that lead-in? We want to have an organized thought process, and the reason we want to do that is because by having that organized thought process, by knowing how many each question requires and knowing what those clues are, we're able to save time while we read the question so we don't have to reread it, but also we can take a focused approach and know exactly which clues we're going to be keeping an eye out for so that we can answer that question efficiently and correctly. So I see a lot of people saying most likely, and some people saying diagnosis. I see some people jumped ahead to the vignette itself, but we're not quite there yet. We'll get there now. And it's important not to jump ahead, right? Because that anxiety and that nervousness can sometimes cause you to jump ahead and miss points unnecessarily. So yes, most likely diagnosis, excellent. Let's go ahead now and read that vignette. Now in our coaching sessions, our coaches will stop you after every sentence and ask you what's important, what do you want to highlight, what are you thinking, what's on your list of differentials. Since we can't do that today, I am going to ask you guys to keep in mind what you think the most important words are, then we'll go over those together. Paros will go over that with you. And I'll give you a second after every sentence to kind of gather your thoughts, because we can't do that with all of you individually here this evening. So here we go. A 50-year-old man presents to his primary care physician with gradual onset of shortness of breath on exertion and a dry cough, both of which have worsened over the past year. He denies nosebleeds. He has a 20-pack-year history of cigarette smoking. He is a plumber by trade. Physical examination reveals mild hypoxemia and a bluish tinge to his skin and mucous membranes. Arterial blood gas values on room air are pH of 7.42, partial pressure of carbon dioxide 42, and partial pressure of oxygen 79. Pulmonary function testing reveals increased physiologic dead space and decreased total lung capacity. Carbon monoxide diffusion in the lungs is 50% of predicted value. A high-resolution CT scan of the chest is performed and demonstrates diffuse ground glass opacities with some cystic changes. And once again, which of the following is the most likely diagnosis? And before we move on, and before I hand it off to Paros, I'd like you guys to let me know what are some of the important clues in this vignette. Please enter that in the question box. And Paros will go over that with you guys here in just a second. I see people saying the DLCO, HRCT findings, DLCO less than 50, ground glass opacities, normal pH and CO2, smoking, plumber, blue skin, excellent, all important things, right? And with that, I'm going to go ahead and hand it over to Paros. Paros.
Thank you, Sean. So we've kind of highlighted what we think are some of the important things in this vignette. So first and foremost, demographic information. So age, gender, sex. In this patient specifically, this patient is having shortness of breath on exertion and a dry cough which are gradual. He has a 20-pack year of smoking. He is a plumber, so that's important in terms of occupational exposures. Physical exam tells us that he is hypoxemic and has a bluish tinge to his skin. Anytime you see ABG values, especially in a respiratory question or a acid-based question, those are all going to be important values. That's why we highlighted that. They did do some testing as well, so those results are going to be important as we get to this diagnosis. So increased physiologic dead space, decreased total lung capacity, we'll keep that in mind. The DLCO is also 50% of predicted. And then also specifically, they did some imaging, and that showed diffuse ground glass opacities with some cystic changes. And all of these combined, these highlighted phrases and words and numbers will help us get to this diagnosis. So this is probably, looking at it, maybe a one-step question, although you can tell there's a lot of information here to parse through. But I think we need to look at all these signs, symptoms, and results and try to come up with a diagnosis. So this could be a one-step question. So let's go ahead and look at those answer choices. So we're going to start our way start from the bottom and work our way up. So we're going to start reading answer choice E and then work our way upwards. And the reason we like to do this is that it ensures that you get through and read all of the answer choices and that you're not biased by something that you see early on. So we're going to go ahead and do that now. Answer choice E, silicosis. D, granulomatosis with polyangitis. C, desquamative interstitial pneumonia. B, chronic obstructive pulmonary disease. And A, acute respiratory distress syndrome. So we're going to go ahead and open up the poll. Go ahead and take a couple seconds to select the answer choice that you think is correct, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. So yes, as you notice, we've highlighted these things for you. And the reason we do that is because it's important to know what's important and what's not. But also, if you get stuck while you're reading these answer choices, it's easy to find those clues so you're saving time and not having to reread things to jog your memory. So it is a time-saving technique as well as a technique to help you stay organized and keep your thought process on track as you try to score as many points as possible on your exams, whether they're exams in med school, step 1, step 2, step 3, or COMLEX or comp. It's important to have that organized thought process. So we hope you find that helpful. All right, let's give it a few more seconds here. And let's see what you guys selected. Looks like in first place with 37% of you guys picking the answer was silicosis, and a close second was COPD. So let's see what the correct answer is. And the correct answer is C, desquamative interstitial pneumonia. So with that, I'll hand it back off to Paras.
Thank you, Sean. So yeah, definitely a tough question here. So Sean has pulled up a table here on restrictive lung diseases. So let's take a look first at the different types of lab values. We'll see, there's a decreased lung volume, decreased total lung capacity. And so let's try to correlate that with our patient. So this patient has a gradual onset of shortness of breath on exertion, dry cough, hypoxemia, and they also gave us some pretty important CT findings of diffuse ground glass opacities with some cystic change. This collection of things is concerning for C, or desquamative interstitial pneumonia. This is a pretty rare disorder, but it manifests as a gradual onset of shortness of breath in a middle-aged patient who is a smoker or has a history of smoking. And as you can see there, this is a middle-aged patient, and they told us this patient has a 20-pack year history of smoking. So the right risk factors and demographics. So a CT scan of the chest in a patient with DIP would not normally show honeycombing, which is something we see with other types of restrictive lung diseases, but would instead show diffuse ground glass opacities with some superimposed cysts, okay? And as you can see in that image there, you can see a little bit of that honeycombing, but that's some of the other restrictive lung diseases that we'll actually be talking about later today. So in this disease, you have a mild decrease in total lung volume and a decrease in diffusion capacity, which is what they told us with the pulmonary function and carbon monoxide testing, a decreased DLCO and decreased total lung capacity. Now, let's talk about why it's not some of the other answer choices. Answer choice E. So I think this was the most highly selected answer. So this is a pneumoconiosis, and also would present with gradual onset of shortness of breath and cough. And on top of that, PFTs and CT scan would be similar, okay? However, patients with silicosis have usually worked in mining or foundry or glass manufacturing, not what this patient is. This patient, they said, was a plumber. So we don't have that silica exposure that this patient should have. Answer choice D, Granulomatous with polyangitis, or formerly what was called Wegener's granulomatosis. This is a rheumatoid, or sorry, rheumatologic vasculitis. So you can often see a restrictive lung disease pattern, like in this patient. However, there would be other things. You could have hemoptysis, diarrhea, and on top of that, a CT scan would show infiltrative and nodular lesions, not ground glass opacities and cystic changes, which is why D is also incorrect. Let's talk about B for a second, COPD. This is also another highly selected answer. So these patients can also present with gradual dyspnea on exertion and dry cough. Also in a patient who has a significant smoking history like this patient. However, a CT scan would show different things than COPD, than what we saw in this patient. A CT scan would show bronchial injury, bronchial deterioration, almost as if they had the bronchitis type of COPD, or if they had the emphysema type, you would see destruction of the septa that leads to the increased lung volume of a COPD patient. On top of that, what we're seeing in our patient with pulmonary function testing is a restrictive type of pattern. However, COPD, as we know, is an obstructive pattern of lung disease where you actually have an increased total lung capacity. This patient, it was decreased. So those things kind of point away from COPD. And lastly, A, or acute respiratory distress syndrome, or ARDS is often referred to. So this often can present with dyspnea, decreased lung capacity, hypoxemia. However, this is actually, the onset is much shorter. For those of you who've seen this, this is commonly in patients who have sepsis, who had severe trauma, who are in the ICU, and they develop acute respiratory syndrome. So as you can tell, acute changes, not necessarily gradual. On top of that, as you can imagine with an X-ray or CT chest, you would kind of see more of a whiteout of the lungs and not really seeing too many opacities or cystic changes. So a couple things that point away from A. So the takeaway point from this is really using all of the clues, the physical exam findings, the lab values to help cross off certain things and help hone in on the correct answer.
Excellent. Thank you, Paras. 17% of you guys got that right. You know, it was a tough question, so good job for those of you who got it. But for those of you who got it wrong, hopefully you'll be able to get it right when you see it on test day. So with that, let's go ahead and move on to our second question of the evening. Once again, you guys will see that the answer choices are covered up. For those of you guys just joining us, that is by design. We cover those up so that you guys are not distracted by the answer choices, so that do not let those choices dictate your thought process. And so that if you see an answer choice you're unfamiliar with, you do not panic as you're trying to answer that question. Next, what we will do is we will read the lead-in. Which of the following is the most likely diagnosis? All right. Now, not too many words here, so I'll ask you, how many steps do you think this question will require? Is it a one-step question, a two-step question, a three-step question? And what are the key words in that lead-in? Please take a second to let us know in the question box. And of course, we will go over that with you. Or Paras will go over that with you here in just a second. Great, I see some wonderful responses coming in. A lot of people saying it's a one-step question. A couple people saying it's a two-step question. And like I said, Paras will go over that with you guys in just a second. And once we have that, and the reason why we do the mapping out of how many steps we require is because it's easy sometimes to miss a step and answer the wrong question, or to miss important clues that take us from step one to step through, and maybe even step three if needed. So it's important to keep your thought process organized, like I've been saying here earlier this evening and throughout all of our question labs. So with that, let's go ahead and read the vignette. A 67-year-old man comes to the local community healthcare clinic, and reports shortness of breath after even brief exertion and a chronic non-productive cough. He is a retired construction worker and has a 40-year history of cigarette smoking. He is allergic to penicillin. A chest X-ray reveals scattered calcifications in the peripheral lymph nodes of the upper lobes. The pulmonary function test is shown in the image. I'll give you guys a couple of seconds to take a look at that image. And now that you've taken a look at the vignette and the image, we'll go again with the lead-in. Which of the following is the most likely diagnosis? So take a second and let us know, what do you think the keywords are in this question stem, and type in your responses in the question box. I see people saying age, chronic cough, construction worker, smoking, calcification. Upper lobes, calcification. Excellent. So people are picking up on the clues. And with that, I will turn it back over to Paris. Paris.
Thank you, Sean. So again, we've kind of highlighted what we think are the important things in this vignette. So, like you guys mentioned, demographics, good, 67-year-old man, and also his symptoms, shortness of breath on exertion, and a chronic non-productive cough. Risk factors or any kind of occupational exposure, so construction worker, other risk factors, especially when dealing with the respiratory system, so smoking, 40 pack years, that's a lot. In this question, I'm not sure if the penicillin allergy is going to be super relevant, but anytime you see a note, a listed medication allergy, it's always good just to make note of that and so you don't forget it. They did give us chest X-ray findings that showed scattered calcifications in the peripheral lymph nodes of the upper lobes. Probably one of the more important things in this question, of a few important things. And then obviously that image of the PFT there below is going to help us out a lot as well. So in terms of how many steps, I agree, probably a one-step question as well, getting to a diagnosis. However, there's going to be, again, a few things to parse through and kind of try to piece together to come to that one-step diagnosis. So it may be one step, but there's going to be a good amount of thinking to do here. So let's go ahead and look at those answer choices. So again, we'll start at the bottom and work our way up so we don't bias ourselves. E, silicosis. D, coal workers pneumoconiosis. C, chronic obstructive pulmonary disease or COPD. B, borreliosis. And A, asbestosis. So let's go ahead and open up that poll. We'll give everyone a couple seconds to select an answer choice, and then we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. Well, let's see how you guys do on this question. We'll give you guys a few seconds to submit your responses. Remember that on test day, there is no penalty for guessing, so you should never leave a question blank. And so even if tonight you're struggling with these questions, don't worry, it's okay. Take your best guess, because we're going to go over the correct and incorrect answer choices here in just a little bit. And on that same note, when you guys are doing practice questions, it's also important that you guys review the incorrect and correct answer choices to make sure you got the question right for the right reason. And if not, you understand why you missed it, okay? Each question has several different topics that you can cover. In this one particularly, you have 5 topics that you can learn from. So make sure you get the most out of each practice question. Let's see how you guys did. Looks like in first place it was a close one, was silicosis once again, and asbestosis was in second place with 31% of you guys picking answer choice A. Let's see what the correct answer is. And the correct answer is E, silicosis, and 33% of you guys got that right. So well done, everybody. Let's take a look and listen to Paris's explanation. Paris.
Thank you, Sean. So I believe Sean actually has a nice figure here. Now these flow volume loops are going to be very high yield to understand. You will definitely get these on step 1. So it's important to know what you're looking at. The most important and helpful things, just take a step back, look at the x-axis and look at the y-axis. So if you can see there on the left image, the obstructive diagram, you can see that the x-axis has to do with volume. So you can see that it's shifting to the left, indicating that you have more volume in general. And that's kind of a nice, simple way to put it. Versus the right, the loop is shifting to the right for the restrictive, indicating overall less lung volumes. Now, it's important to also do this, and we won't go into each specific parameter today, but to look at each of those parameters and to look at that graph to make sure you understand okay, why is it increased? Am I seeing that it's increased? Am I seeing that it's decreased? So that when you get a flow volume loop diagram on your test day, you'll be able to, very easily select if you think it's an obstructive or a restrictive pattern. So knowing this, let's go back to our question. So this patient has symptoms of shortness of breath and chronic non-productive cough. And that's kind of, again, pointing to a chronic lung disease, which is what our topic for today is. So the patient's PFTs also support a restrictive lung process. We see that this patient has a reduced lung volume compared to predicted. So again, a restrictive pattern. We also were told that there's calcifications in the lymph nodes of the upper lobes, also known as eggshell calcifications. And this finding is often seen in silicosis, a restrictive lung disease. So when we talk about PFTs, it's important, as mentioned, to categorize it as obstructive or restrictive. And one of the helpful ways, again, as we mentioned, is to look at that total lung capacity, look at other things that are given, FEV1 over forced vital capacity. So look at how much of that volume is expired over that first second. These are all things that will help tell you if it's restrictive or obstructive. In this case, this patient has a restrictive disease process. And this patient also has smoking, and we know is also a construction worker as well. So maybe coming in contact with rock, glass, sand, other things, all things that are risk factors for the development of silicosis. So let's talk about the other answer choices. So D, co-workers pneumoconiosis. So this can also present with a dry cough and shortness of breath, but this disease often affects coal miners. Sometimes you can see it in urban patients as well, but most commonly coal miners, Lung volumes are typically decreased as seen as in restrictive lung diseases. And the other thing is, although coal workers pneumoconiosis can affect the upper lobes of the lungs, you wouldn't expect to see broken up calcifications like we did in this patient. That's more associated with silicosis. So D is incorrect here. C, COPD. So again, a non-productive cough and dyspnea on exertion could be explained by COPD. This patient also is an extensive smoker. However, as we mentioned, COPD is an obstructive disease, so we would expect to see an increased total lung capacity and other obstructive parameters. You can see an increased total lung capacity and a decreased FEV1 over FVC, which is different than restrictive, which it can actually be normal or even increased. So this is not an obstructive pattern in this patient, so C is incorrect. B, or borreliosis, also a pneumoconiosis that can present with the same symptoms. However, the main risk is in patients who work in the aerospace industry or manufacturing industry. PFTs would also show a restrictive pattern similar to this patient. However, an X-ray would show nodular infiltrates and hilar lymphadenopathy, not what we're seeing in this patient. And lastly, A, I think this is the next highly selected answer, asbestosis. It's also a pneumoconiosis, can present similarly. The main occupational risk factors are with shipbuilding, roofing, plumbing, things like that. It's important to know that patients are at an increased risk of mesothelioma and bronchogenic carcinoma. It's also a restrictive lung disease. However, this typically affects the lower lobes of the lungs, not the upper lobes as in this patient. So again, the takeaway from this question is using all those signs and symptoms that you thought, and especially those PFT testings and chest x-ray to come up with the pattern of pathology and pathophysiology that you think is going on, and then looking at those answer choices to see which one fits what's going on in this patient.
Excellent. Thank you, Paras. One thing to keep in mind is a lot of students memorize that R for restrictive lung disease, R, it shifts to the right, but keep in mind that on the test, they can switch these labels okay? And these can be going in either direction. So make sure you pay attention to that access and what those numbers are doing so you don't fall for an easy trap on test day and select the wrong answer, okay? That's one of the easiest things a test writer can do to trip up a student. So don't fall for that trap. So with that, I'd like to ask you guys a question. And that question is, how would you describe the results that you are seeing Well, it looks like that poll closed on me on accident. Let me see. Well, I'll just have you guys think about it and respond in the question box, okay? How would you describe the results you are seeing after your study session? So let us know in the question box. I got a little technical difficulty there. A, I am seeing great results and I am happy. B, the results do not match my efforts. C, I'm plateauing. D, I'm spending too much time and falling behind. Please let us know in the question box, A, B, C, or D, how would you describe the results you are seeing after your study sessions? We see some people saying I'm spending too much time and falling behind. Some people saying I'm seeing great results and I'm happy. I'm plateauing. The results don't match my efforts. Excellent, and thank you for those responses. We'll give you guys a couple more seconds to let us know. Some people saying B, C, and D. I have somebody saying A, B, C, and D. That's interesting. All right, well, let's talk about that for a second. So if you selected B, C, or D, the results aren't matching your efforts. If you're plateauing, if you're spending too much time and falling behind, you might want to consider our RX coaching service. What we do is we work with you on a one-on-one basis. You'll work with one of our wonderful coaches like Dr. Vicaria here tonight or Mark. And the first thing we'll do is we'll give you an assessment, and we'll talk about that assessment in detail and come up with a study plan. And the reason we do that is so we can get a good, accurate, and recent baseline of your strengths and weaknesses and come up with a game plan that's going to be efficient and effective. A lot of times students spend a lot of time studying, but they don't study the right things in the right order, which is why they don't see the results that they should be seeing, or they spend too much time on a certain subject, or they end up plateauing. There are a lot of USMLE test prep programs out there, and they generally focus on knowledge and content, but they don't focus on test taking skills. So in addition to knowledge and content, we're going to work with you on a one-on-one basis to see what those test taking skills are that you have, and if you're deficient, what exactly you're deficient in, so that we can work on that together and help you master those test taking skills so you can maximize your potential on test day. All of our coaches are highly trained and they're certified. They have a very extensive training process. And of course, all of our students get access to RX 360 Plus, which includes RX Bricks. You can see one of our testimonials here. We have helped many students accomplish their goals, scores above 260 and everywhere in between. We recently had a student go up 73 points. We've had students go up 100 points. So it is a wonderful program, and what you get out of it is that individual one-on-one attention, because as you guys know, everybody learns differently, everybody thinks differently, so that cookie cutter approach is not always the best way to maximize your potential, and the individual attention that you can receive from a trained coach can not only save you time, it can help you reach your peak potential and help you get that residency you want, but more importantly, become the physician that you've always dreamed of becoming. So if you're interested in RX Coach, please visit us online at rxcoach.com. That's rx-coach.com to set up a free consultation to discuss the tutoring program and how it can benefit you. As always, if you want general study advice or study planning advice, you can receive that at firstaidteam.com. But if you are interested in coaching and your test is coming up, I know a lot of you guys have it coming up soon, you know, schedule that consultation, learn more about the program, and let's see if it's a good fit for you, okay? So with that, let's go ahead and move on to our third question of the evening. So we'll go ahead and start with the lead-in, and here we go. Which of the following was most likely in this patient immediately on his arrival in Colorado? Which of the following was most likely in this patient immediately on his arrival in Colorado? Go ahead and take a second and let me know, what do you think are the most important clues in that lead-in? Okay, we have some people saying Colorado. Somebody astutely picked up on immediately, which is definitely going to be important. Excellent. So we have some good responses coming in. Likely diagnosis, most likely. All right. So let's go ahead and read that vignette. A 19-year-old man comes to the university clinic because of shortness of breath, nausea, and fatigue since moving into his new dorm room yesterday at a college at a high altitude in Colorado. He has had occasional difficulty breathing that is worse when arranging his furniture in the dorm. He is a healthy, well-developed man with no medical illness. His physical exam is normal. Which of the following was most likely in this patient immediately on his arrival in Colorado? Boris.
Thank you, Sean. So as you can see, we've highlighted a couple things here. So in the question part, most likely in this patient, but also a key phrase here is immediately on his arrival in Colorado. Okay, that's going to be one of the important things. Whenever you see that, whenever you see immediately or delayed, always make note of that. So looking at the vignette, again, demographics, this is a 19-year-old man. He has shortness of breath, nausea and fatigue, and he recently moved into his dorm or college at a high altitude in Colorado. He has had occasional difficulty breathing on exertion, and I guess otherwise healthy. So those are what we think were the most important things in that question. So maybe in terms of how many steps we think this question is, this could be a two-step question. I think one, we need to figure out exactly what's going on in this patient, and then two, figure out what would be happening in the patient immediately on his arrival. So maybe a two-step question here. So let's take a look at those answer choices. And again, we'll start at the bottom and work our way up. E, increased blood HB or hemoglobin. D, increased PaO2. C, increased BPG or biphosphoglycerate. B, decreased ventilation. Or A, decreased PaCO2. So we'll go ahead and open up that poll. Go ahead and select the answer choice that you think is the correct answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. So we've already gone ahead and given you some good clues and highlighted those for you. So hopefully that'll help you guys out. We can do better on this question than we've done on the last two and have some improvement here. So give you guys a few seconds here to respond, and then we'll go over the incorrect and correct answer choices. Make sure you guys stick around until the end so you guys can have your shot at being the lucky winner tonight of our raffle. As you know, you must be present to win. And next week, like I said, we will be covering bacteriology. So hopefully we'll see you then, Tuesday at 6 p.m. when we cover bacteriology. All right, looks like the responses are coming in. We'll give you guys a few more seconds. Excellent. Well, let's see what you guys selected and how you did. So it looks like in first place with 40% was decreased PaCO2, and C was in second place with 37% of you guys picking increased BPG. Let's take a look at the correct answer. And the correct answer is A, and 40% of you guys got that right. So our best performance of the evening yet. So well done to those of you guys who got it right. Those of you who didn't, don't worry. Boris is going to explain it to you now.
Thank you, Sean. So great job, guys. Great job in this question. So the important thing, and Sean has a nice table pulled up here, was that recognizing this patient has moved to high altitude, okay? And they mentioned that in the question. So this patient had altitude sickness, and the main thing that's going on is that there's a decreased atmospheric oxygen. So the body compensates by increasing its ventilation or respiratory rate. So as a result, you're basically blowing off or expiring more CO2. So that would lead to a decreased PaCO2 or respiratory alkalosis, okay? That's the first thing that happens. Now, over time, as you can see in the additional bullet points in that table, you can start to get more chronic changes once you start to stay there or live there for a long amount of time. Changes in bisphosphoglycerate, erythropoietin, bicarbonate in terms of renal excretion. So a lot of other chronic changes. So when we go back to this question, this patient does have altitude sickness, nausea, fatigue, shortness of breath. However, this patient just moved there yesterday, so within 24 hours. Even if they didn't say that, keep in mind the question said, what was the most likely change immediately on his arrival in Colorado? So immediately, the correct answer would be A, decreased PaCO2, as we mentioned just recently. Any other changes, including the bisphosphoglycerate, erythropoietin, etc., that would be chronic, and that would be expected to take some time. So let's talk about some of the other answer choices. E, increased blood hemoglobin. This could be a chronic compensatory mechanism for people who move to high altitudes. However, this is an acute presentation, and again, this question's asking for what's happening immediately on arrival. E is more of a chronic compensatory mechanism. D is something that actually happens when you have high concentration of oxygen and you're breathing in high concentration of oxygen, which is actually kind of the opposite of what's going on here because we're at a high altitude. So D is also incorrect. C, I believe this was the second most highly selected answer. So this also takes time to occur. It takes time to produce bisphosphoglycerate, which can cause a rightward shift in that oxygen dissociation curve. However, this is more of a chronic compensatory mechanism and not something you would expect immediately on arrival. B, decreased ventilation. That's actually incorrect as well, like we talked about. This patient would actually be ventilating more to try to get off more CO2 in response to the low PaO2. So those other answer choices are either incorrect or chronic changes, not something that's happening immediately. So the key takeaway from this point is, for those of you who selected C or E, is making sure you're taking note of, what the question is asking you, and really using that to hone in on the correct answer choice and ruling out distractors.
Excellent. Thank you, Paras, and good job, you guys. And now we're going to go ahead and move on to our last question of the evening, and then we'll have our raffle. So let's try to finish strong. Here we go. We're going to start with that lead in like we normally do. That lead in is, which of the following is most likely during forced expiration? Which of the following is most likely during forced expiration? I'd like you guys to let me know what are the two most important words in that lead in. You can submit your responses in the question box like you have been. We'll give you guys a few seconds. See people saying forced expiration. Excellent. And now let's go ahead and read that vignette. A 64-year-old woman comes to her primary care physician because of gradually worsening shortness of breath. She also expresses concern that her lips turn blue when she ascends stairs. On physical examination, the physician notes increased anteroposterior or AP diameter of her chest, hyperresonance on percussion of lung fields, and increased respiratory effort. The patient's pulse is 90 per minute and blood pressure is 110/70. She has had well-managed diabetes for 8 years and a 40-pack-year history of smoking. The patient is sent for evaluation of her lung function. Which of the following is most likely during forced expiration? With that, I'll give you guys a few seconds to let us know what you think are the most important clues in that vignette. We'll give you guys a few seconds to submit your responses, and then we will go over the clues and the answers so you guys can take your pick. And hopefully we will have our best response and most correct response of the evening. I see lips turning blue, smoking, barrel chest, wide AP diameter. Excellent. I see you guys are on the right track. And with that, I'll hand it back off to Paris.
Thank you, Sean. So in the vignette, obviously, as we mentioned, demographic, so 64-year-old woman, her symptoms, gradually worsening shortness of breath. Also, lips turning blue, that's not a good thing. So definitely highlight that. They did tell us, and some of you commented on this, increased AP diameter of her chest, which would thus make sense that she has hyperresonance, and increased respiratory effort, which we can also gather from the previous stuff as well. We know she's diabetic, we know she's a smoker. So then when we look at the question, it's asking what's most likely during forced expiration. So that's where we should be thinking about in this patient when she is forcefully expiring or forcefully breathing out air, what are we going to be seeing? So that's what I want you guys to think of before we look at these answer choices. Okay, so let's go ahead and pull up those answer choices. And this is going to be maybe a tough question. These are always the respiratory physiology questions are always tough. So E, transmural pressure of 0. D, negative pleural pressure. C, negative alveolar pressure. B, intraalveolar pressure equal to atmospheric pressure. And A, airway compression that limits flow. So we'll give everyone a few seconds, maybe a couple more seconds for this question, and then we'll let you guys select the answer choice that you think is right, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. Yeah, absolutely. This is a challenging question, but these are pressures that you are going to need to know, and it's very testable. It's high yield, and sometimes it gives students a lot of problems. So don't worry. Just pay attention to Paris here in a moment if you're confused by this topic, and he'll explain everything to you. So it is our last question of the evening. We'll give you some extra time to fill this one out. And remember to stay around until the end because we do have that raffle, and somebody is going to walk away with a valuable prize. And like I said, next week we will be doing our session on bacteriology. And on October 26th, we have our webinar with Dr. Lee. So if you guys aren't familiar with that one, please visit us at firstaidteam.com for more information. So you've got 5 answer choices. We'll give you guys a few more seconds to respond here. Looks like there is a strong favorite. All right, let's see what you guys selected. Looks like 40% of you guys selected answer choice A, airway compression that limits flow. And in second place with 20% was answer choice D, negative pleural pressure. Let's go ahead and see what the correct answer is. And the correct answer is A, airway compression that limits flow. So 40% of you guys got it right. Well done to those of you who did. Those of you who didn't, don't worry. Paris is going to explain it to you now. Paris.
Thank you, Sean. Great job again, guys. Great job. This is a tough question, and you guys did really well. So, I forgot to mention how many steps this question could be. And, when you look at the question, you could say, forced expiration, maybe just one step. But the key to keep in mind in this question is this patient's physiology is going to be different. So I would say this is a 2-step question, figuring out what disease or physiology this patient has, and then how is forced expiration going to look like in that patient? So probably a 2-step question. So this patient has hyperinflated lung volumes, increased AP diameter, long smoking history. So a classic patient with emphysema type COPD, okay? So in that type of COPD, you have destruction of elastic fibers and thus a loss of elastic recoil. Thus, you have an increase in compliance because compliance is inversely related to elastance. So decreased loss of elastic recoil and thus increased compliance. Because of that, the amount of pressure that can be generated in the lungs during exhalation is actually reduced a little bit. okay? So the other thing to keep in mind is when we're talking about breathing, we're talking about pressure in the atmosphere outside the patient, and we're talking about pressure in the alveoli, or the actual breathing tubes, and then also the pressure within the pleural space, or intrapleural pressure. So three things: intrapleural pressure, intraalveolar pressure, and then also atmospheric pressure. So normally, right before inspiration begins, your intrapleural pressure is negative, okay? And as you start to breathe in more air, that intrapleural pressure will become more negative to allow more air to come in. So at the start of expiration, when you breathe out, your intrapleural pressure will start to increase again, okay? So during forced expiration, your intrapleural pressure is positive, okay? And as a result, that's kind of compressing the airways, because remember, we're separating intrapleural pressure from intraalveolar pressure. So now you have a positive intrapleural pressure that's going to compress those airways a little bit, okay? And this applies to all patients, not just COPD patients, but it's more prominent in COPD patients. So positive pleural pressure will compress those airways. Now, this is one of the reasons why patients with COPD will breathe slowly. It's called breathing through pursed lips, or pursed lip breathing. This is a way that patients with COPD breathe to try to keep those airways open a little bit. They're trying to increase that intraalveolar pressure a little bit more to prevent airway compression or airway collapse, okay? So that's why answer choice A is the correct answer. Let's talk about the other answer choices. E, transmural pressure. This is the difference between alveolar and intrapleural pressure, okay? And as we mentioned, with forced expiration, this would not be 0. D, negative pleural pressure. As we also mentioned, pleural pressure is actually positive during forced expiration. And then B and C, during actually both passive and forced expiration, the intraalveolar pressure is positive to get air out of the alveoli and into the atmosphere, okay? So both B and C are incorrect. So it's important here, this is the takeaway from this, is really trying to use your physiology knowledge to understand what's going on at the level to be able to answer these types of questions.
Excellent. Thank you, Paras. And, like you said, physiology of respiration is important. It is high yield. And for those of you who want to review that topic, feel free to take a look at this brick on the physiology of respiration. Estimated time here is, about 16 minutes for the brick. Here are the learning objectives. We've got 5 learning objectives. Describe the action of the muscles. Describe the different pressures, right? Exactly what we're talking about in this question. Nice little case connection here for you. And our bricks have these case connections that would really make it easy for you to relate this material to real life situations. We talk about respiration and ventilations, the muscles, like I said. When we keep going down, we have little in training tips there, equation here, wonderful little diagram for you here. And as you guys keep coming down and reviewing this content, you will learn the material. And as you get towards the end of this brick, you will also see some flashcards along the way, some clinical correlations and another case connection. And as you get to the end, you'll see a summary of the take-home points that we want you to learn from this brick. And then you'll be able to practice with some practice questions, and you'll get the explanations once you answer these questions correctly. And if after you've read this and you've done the in-training and you've answered those questions, and you can mark off then these learning objectives to see which ones you're confident with. But if you want to go deeper, if you want a little bit more review or info on this topic, you can go directly to first aid. You can practice with flash facts. You can watch express videos. And then you can practice with AccuMax questions directly related to this topic. And that's really nice because it helps you stay organized. You're not going all over the place. Everything is here on one platform. And so you can keep that organized thought process as you're learning. And as you guys know, sometimes when you're studying a subject, going back and forth between resources takes time and kind of breaks up your thought process and your learning, and staying organized can really help with that. So for those of you guys who haven't taken a look at bricks, I really encourage you to take a look at our bricks, and Jeff will talk about that here in just a second.